Got to get my spine. Get this one. Oh, okay. I think we're live. I think we are. Yes, we are. Let's just check on YouTube. Guys, I'm going to start off today's live talking about the specific topic of how exercises help you recover from a herniated disc. Because all too often there is not this communication with you guys as patients about how what we're doing is helping your back get better. And I think if this conversation was had more frequently in either the surgeon's office, in your osteopath, your chiro, your physio's office, then you guys would be much more informed ahead of doing the actual therapy or intervention that you're about to do. And so I'm going to take this specific example exercise here of the squat. And so you guys can appreciate just how it's helping that herniated disc heal down here in the lower back if you've got one of these. Typically speaking, they're going to be at L5S1 or L45. L45 is going to be L4, L5, the two greens here, and L5S1 is going to be this section here. And so how your rehabilitation works in the first instance when you're learning your exercises, you've got a raging herniated disc, maybe you've got sciatica down the leg, maybe you've just got lower back pain, is that it's going to teach you how to move in a way that controls the spine. And so in many cases, in the early days of that recovery process with that lower back injury, by learning how to squat, you are literally practicing a movement that you are doing multiple times every single day, right? And it might sound scary, the idea of doing a squat. You know, it doesn't have to be in the gym over here, you know, using a heavy barbell. But understand that you are squatting every single day, whether you choose to acknowledge it or not. And the sooner you acknowledge that you are, the better you're going to be. Because you can either continue to get up and down out of chairs in all sorts of silly ways and bounce back and all that kind of stuff and struggle. Or you can start to make some improvement. And literally, in the cases where we have patients coming into the clinic and they struggle with getting out of the chair, just teaching them the technique of how to get out of the chair means that something that hurt doesn't hurt. And it takes this much time, basically nothing, for that change to take place. We haven't healed them in that instance at all. Of course not, right? But we've taught them how to move in a way that stops aggravating the injury down here. They've started on the path of learning spinal control. So when we're performing an exercise like a squat, in the early instances, yes, we might struggle to do it. Yes, we might create a little bit of aggravation because we're not very good. But the early benefit to your recovery, that's that sandwich truck again, just on cue. The early benefits to your recovery in the lower back are that you start to learn how to control your spine in the real world. That means that the daily aggravations of your sciatica, of that herniated disc, are happening less and less frequently because you're starting to be more effective from the very first go at performing this movement, the squatting movement. Now in the medium term, and guys, if you guys have any questions about your back pain and sciatica, your herniated discs, you can always post them down in the comments and I'll go through those in a second. But in the medium term, as you start to get more proficient at the exercises and you're better at stabilizing your spine and you're protecting this lower back more and healing is starting to take place, we've removed the constant aggravations that are happening day in, day out. So healing can actually start to take place and gather a little bit of momentum. Remember, these fibers of the annulus fibrosus that are the things that are injured in the case of the herniation, as well as other sections of the segment itself, those things are trying to heal every single day, but unfortunately they are under more strain because of the way in which we live. And so they're a little bit more vulnerable to those flare-ups. They're under strain compared to if I had injury to the ligaments of my elbow, I can put it in a sling out the way. And so if I flare it up, it's going to be more disruptive compared to if I flared up the tissues of the skin, for example, in the case of the graze on the elbow. Those tissues turn over very, very quickly. But learning that proficiency in the early days helps reduce the frequency of aggravations and flare-ups. In the medium term, learning movements like the squat actually strengthens up the musculature around this spine here, your midsection. We have 4 sections of the core, right? We've got the front of the core, the side of the core, the back of the core, and the core of the core, which is the spine. And so in the short to medium term, we're actually strengthening up 3 of those sections, the musculature, because muscles respond a lot faster than the spine itself. And so they are strengthening up. And therefore you have more movement competence, meaning you can move more effectively without straining tissues. And you have more muscular resilience because the muscles have started to change now. And so in that sort of scenario, we now have more and more protection from silly little flare-ups, coupled with more and more healing taking place, meaning we're starting to get positive feedback as opposed to so often the negative feedback that catches so many of you guys out. And I will come to comments in just one moment. I can see a good couple coming through on TikTok, so I'll get to those in a second, guys. But now we've built muscular protection. So more and more healing is taking place. And you guys know, like if you've ever had a graze on the surface of your skin, if you pick the scab on day 2, it bleeds again. But if you pick the scab on day 5, 6, 7, 10, 14, you see that pink tissue underneath. You know it's not quite healed, but it's not quite the same as the early healing. It's actually started to develop a little bit more resilience now. And it's not bleeding all over the place when you pick the scab. It still might hurt a little bit when you pick it off, but it's really making progress. And then the long-term side of your rehab, to complete the arc of how exercises fix your back or help your back recover in the scenario where we've got a herniated disc, is that you're literally putting load back on this spine again. You're squashing down on that and you're asking those fibers of the annulus that now are starting to heal and maybe looking a little bit more like this, right? They've reconnected. You're getting those fibers to start to test them carefully with load, and they are responding in kind. They are starting to strengthen up. And the process therefore never stops. It's just a continuum. How strong at this point do we want those discs to become? But we know for a fact, because 6 weeks ago we could not bear any load on that disc, and now we can bear 5, 10, 15, 20 kilos. We go forwards into the future, months in advance. We've now got, you know, a significant amount of load tolerance. That is how our rehabilitation helps us. It helps us by protecting us in the short to medium term more effectively. And in the long term, it helps actually be a tool to safely and reliably apply load to the spine to strengthen it back up again. And with that, I'll come over to some comments. I might go back and refine some of those points in a second. But guys, if you've got any questions, if you're watching this on YouTube, you guys can comment in the comment section. We're going over to TikTok for a couple on here. Let me just scroll back through to see if I can find the first one. Bear with me, guys. Okay. Just trying to not miss anything. Why are there no new treatments for herniated discs? There is no new research, no new treatments. I don't know necessarily that there aren't any new treatments. I know we got something mentioned relatively new by one of the members in the program relatively recently, which was about a new compound that was injected into the disc to help with the healing side of the disc. I forget the name. It was something like Disc X or Fibrin or something like that that was injected into the disc. You've got things like stem cell applications. You've got things like PRP applications, etc. But I would put it back to you and I'd say, well, why are there no new treatments for a strained lateral collateral ligament, right? The big thing with back pain and specifically herniated discs is that so much of the reason one person struggles and another doesn't is because so often we are not, or you guys aren't, part of the solution. You're like, here's my problem, I'll put it in a little box and I'll give my problem to you and you give me back a solution. And that's not how back pain works. You come over with your little problem and you say, hey, can you come and help me fix this and we'll do it together. And too often it's not a collaborative approach. Many of you guys will have experienced this. It's not a collaborative approach. I go there, I have something done to me, then I go away. That's not how you fix back pain, I'm afraid. It's too much of a you problem. I say about this, and I don't say it in a mean way, back pain is a you problem. It is a you problem. So you must be part of the solution. And I don't think it needs necessarily any new treatments. What it does need is a new understanding perhaps, or a more robust understanding that actually there are a lot of things we do every day. And if we look after ourselves well, what we might be looking for is, I want to be able to get away with abusing my back and not pay for it. Well, that's going to be difficult, unfortunately. Emmett said, I have an L5-S1 bulging disc. How can I help this? By working a desk job, 10 hours, 4 days a week. That is tough. The average adult spends 9.5 hours a day sitting. Probably most of that 10 and a half you're sitting. And then when you go home, you're sitting more. The best thing we can do is all we can do, right? That's the level of analysis that you want to have. You do the best job you can. And the body is actually quite remarkable. It really will respond well. But that's where education comes in. Can we do things a little bit better in the office? Can we get something like a sit-stand desk that we can use? Can we adjust our positioning? Can we take a little bit more breaks? Those kind of things make a big difference. In so much that they're giving your back a break, right? Because if it's L5-S1, that's putting a lot more pressure on that disc, 40 to 90% more when we're sitting down. And so if we can break that up, we're going to help ourselves. But what we do need to acknowledge is that there's also time outside of that. You're awake for 16, maybe 17 hours of the day. So that's 6 or 7 hours that you could be working diligently towards improving your health and well-being. And so spending time doing relief-based work, spending time doing your rehab exercises and doing your strengthening to rebuild resilience will go a very long way. And quite frankly, more or less all of the members and patients over the years, like they still have commitments every day. They got kids at home, they got work they've got to do. You can still get better, but you have to do the right stuff in the time you've got available. All too often, people get worried about when they're sleeping, about the times they can't do good things for their back, but they're not actually executing at 100% success and efficiency during the time of the day that we can do good things for the back. So focus on that first, try your best to make amendments while we're at work, and then progress on from there. Jeff has said on YouTube, any tips for people to help them keep proper form when doing the squats and hip hinges? The best thing I would suggest, Jeff, is go and look at the tutorial videos. Now, there are some videos that we've got on the playlists, on the YouTube channel, but obviously on the program, you want to make sure you've got a neutral spine. You want to keep your core engaged. There's a great video on the channel on the tape test. The tape test is where we stick some tape along this section of the spine here. So when we do a squat, if we round our lower back or hip hinge and we fold forwards, the tape pulls off and we can actually feel it. One of the big problems that we have with lower back issues is you're not very good at actually feeling what's going on there, because you weren't in the first instance, but you're even less good now, because the tissues that get injured in the lower back are the tissues that have those mechanoreceptors in, those proprioceptors in. So they're not necessarily as good. You're not very good at being aware of when your back is starting to move or not. And so using the tape to stick over the top gives you that extra sensor. This is something we really put a lot of emphasis on. Like when we're doing the dead bugs, for example, we've got our hands on our core here. So we're actually feeling, we're not placing, that doesn't feel anything. You're actually pressing in so you can feel the core actually be engaged. You've got the tape. We use the towel as well so you can feel if the spine is moving, which is wrong, by the way. You should not be moving the spine. And so when we're doing the squat, and we've got the tape on our back, we can feel if the tape's going to start pulling off when we do that. Those are the kind of things that can really help you get those movements right. But I would strongly suggest using the tutorial videos, because actually a lot of those tutorial videos that we have, like in the program, etc., they're like 20, maybe 25-minute videos in some cases. And then it goes through all of those different things. Record yourself. That's probably one of the biggest tips to get the proper form, is actually record yourself. Guys, those of you that have been struggling with lower back pain, how many times in the last week when you've been doing your exercises have you actually recorded yourself and then watched the video back afterwards? If the answer is 0, well, I haven't done my exercise, well, that's a problem in of itself. But how many times are you actually recording yourself? What gets measured gets accomplished. And if you're not measuring and observing and recording your actual form, how can you possibly hope to get better? Because so often the difference, there's a massive difference between what you're supposed to be doing, what you're actually doing, and what you think you're doing. And so often when we get members that post their videos of their squats, Jeff, like in this sort of scenario, or the hip hinges into the program, they'll even comment and say, I didn't realize I was doing that, and then I uploaded the video and I was like, gosh, that's crazy. That's one of the, there are these tools, and in the updated version of the program, we talk a lot about using recordings so you can see exactly what you're doing. Those are some of the biggest tips that you can really have when performing these kind of movements. And don't feel like you have to go so low. Do shallow reps to start with. That can really make the world of difference. Burr has said, I have a small herniated disc at L4-5. I got it 6 weeks ago and steadily it's getting better. Awesome. Exercise is the key, and I finally have a routine I'm satisfied with. That's fantastic. Doing nothing is never, no one ever does nothing, but people say, I'm not going to do anything until it gets better. And that's a false perception of reality. No one does nothing. I say sometimes even a tree does stuff, like it sways a little bit, right? You're doing stuff every day. We just don't acknowledge exactly what it is, and that means we can't really be true to ourselves, in terms of analyzing why we're actually struggling. We've got some comments here. Hello, I have a problem at C3, 4, 5, 6 herniations in the neck. I think I won't go into too much detail on the neck, guys, but one of the big problems we've got nowadays, many of you guys right now will be like this, is you're on your phone watching TikTok. Right? And all of the same stuff we talk about for the lower back is relevant to the neck in modern society. Instead of having a nice smooth backward bending C-shaped curve in the neck, everybody's craning over like so. You're flexing massively the mid portion of the neck, which is why we see these sorts of issues in the mid to lower neck, because you're just putting more pressure through that section over and over again. And often you feel like there's tension in the neck, so you want to stretch it more, so you pull, and only serve to do exactly the same as the knee hugs. Chin tucks and other sorts of exercises are the knee hugs for the neck, right? They're the same old principles that mess your lower back up because they feel nice in the moment, because we're misattributing the tension that we feel as being the problem in need of stretching. Fabio said, hello, 3 mm bulge disc between L4-5. Pain comes and goes, not intense. Any advice? Focus on spine stability. Using exercise like this, the dead bugs, marching bridges, squats, hip hinges, step ups, those kind of things to rebuild strength and resilience and control for this section of your lumbar spine. Do some element of relief work, such as a towel decompression, bed decompression, to regularly take pressure off the spine and mobilize the hips to ease strain on the spine in daily life. things like contrast bathing. This thing is a great device. This is the Cube from Therabody. It just does hot and cold on your lower back. Very, very good. Saves you getting all messy with ice and hot water bottles. And educate yourself in understanding the spine. That's why we do these lives, right? And if you need more help, Fabio, check out the link in the profile page on the TikTok page, because we've got a link to the program there, and you can watch a video. It should be quite helpful for you. Other questions that we've got on TikTok. Can you show 3 of the best rehabilitation exercises for herniated disc in the lower back? So the first, I'll do a brief one here. The first one, as I was discussing at the start of the live stream, is the squat. Because the squat, we hold the spine steady and we're coming down and up. You can go as shallow or as deep as you want, right? You can do our squats like so, right? Some people do it like this. Some people need to hold on to something for a little bit of support. Doesn't really matter. You start where you start. You should always be doing aggravation free with correct choreography, meaning that some of you guys have pain all the time. And so you go, oh, well, I won't do anything till my pain gets better. Doesn't work like that, right? You're still doing stuff every day in spite of the pain. So you may as well do something that's actually going to move you in the direction of recovery. So the squat is an example. You squatted to get out of bed, you may as well squat to get better at it. Hip hinge is another one, coming down like so, right? Learning how to dissociate, separate out movement of the hips from movement of the back. Very important, because so many people, when they try and do a hip hinge, will end up doing something like this, right? Rounding of the lower back. Those 2 are probably going to be the most powerful. Then you've got things like the dead bugs and the marching bridges. They all are very, very low risk ways of learning that engagement of the core. Very, very helpful exercises that should be done with aggravation, without aggravation or aggravation free. And you must do them with correct choreography. And if you can't do a harder version, you do an easier version and an easier version. And until you find what you can do without aggravating the symptoms. And it's not just pain. Some of you guys have numbness, tingling and other sensations, which may not bother you that much, but they're annoying, right? And you just push through those because they don't hurt. Don't do that. Don't push through symptoms, even if they're not, quote unquote, that bothersome. It's a very, very important point of distinction. XY has said, hello, I have a herniated disc at L5S1. Some videos recommend nerve flossing. Does nerve flossing of the leg work? Do not floss the nerve. There is no need to floss the nerve. In order for nerve flossing to be effective, we have to understand how we actually do it. And in the process of exploring that, you start to understand why nerve flossing might feel good in the moment, okay? So the nerve runs from essentially the base of our brain, okay, our brain stem, goes all the way down, the nerve fibers, if you will, goes down through the lumbar spine, comes out through these little nerves, and then it goes down the leg as the sciatic nerve. Our nerves don't really stretch too much, but they can come off tension, so to speak. And so you can get a very good example of this in the neck by stretching what's called the brachial plexus, which is the plexus of nerves that go and run down the arm. If we turn our neck to the side, turn all the way, and then cock our wrist, fully extend our elbow, if we get it just right and tilting, we can start to get a bit of shooting tingliness going down our arms as we put that nerve through its longest possible route. Well, you have to get to that point in order to floss the nerve. So what you have to do for the sciatic nerve is you need to create the longest possible position or distance from the base of the brain to the base of the spine. In order to do that, we have to slouch and round and tuck our chin to our chest. That elongates this pathway as much as possible, which tensions the nerve. Next, what we have to do is straighten our leg as much as possible, and that elongates the pathway down the leg. And then we play around with what's called dorsiflexion, which is pointing in the toes, dorsiflexion, and nodding of the head to create this pulling and flossing motion. And the idea is that the nerve is stuck or something like that, and you're going to pull it through, right? And we think of, oh, this very, very delicate nerve. What we're going to do is we're going to like floss it and rub it through stuff. Like it just makes no sense. But the reason I think that most people, if you do find it effective, find it relieving in the moment, is because what you're doing, if we just take this hole here, imagine this is L5S1 here. When we get into that position, we're just maximally opening out the space. That's all we're doing. So it just creates more space in the lower back. And it comes at a great cost. Because your disc is herniating backwards, irritating the roots of the sciatic nerve, like so, because you have squashed on the front and driven it back, and these fibers have become damaged and incompetent and unable to hold this nucleus in its rightful location. And so all you're doing is reproducing the issue. This is the problem with knee hugs, with child's pose, and all those other kind of things. Yes, there is merit to stretching the hamstrings with a neutral spine. Hamstring stretching should not involve the lower back, because the hamstrings do not act in the lower back. Although they might have implications in the lower back when you're working on them, they do not act across the lumbar spine. The hamstrings insert here at the ischial tuberosity, and they only do the hip extension, and they act on the knee as well. And so why so many people feel the need when doing a hamstring stretch to round over and then wonder why it's not helping their back. Well, the reason it's not helping the back is because you're buckling the lumbar spine forwards. You're doing that flexion with to a maximum degree and aggravating the very tissues that are injured. What you need to do instead is focus on spine stability work. The question should be, okay, so if I'm going to do sciatic flossing, how many times do I have to do the flossing before I can measure some kind of improvement? How do I evaluate if it's working? How do I evaluate if my disc is healed? Is it doing sciatic flossing 300 times, 2 times, 20 times, 50,000 times? Like, how many times is it supposed to be, and when will I know? Because it's not about your pain, it's about the structural integrity of this disc. The sciatic flossing has absolutely no bearing on the herniated disc. It doesn't tell you anything about whether the herniated disc is healed or not. It's absolutely useless, and I would actually argue to the contrary. At the very best case scenario, spending time doing sciatic flossing is time you could be spending doing something more important and more helpful for your recovery. And the more likely and probable and worst case scenario with regards to sciatic flossing is you're actually just making the problem worse. Kind of like picking the scab. Burr has said here, weighted dead bugs, side planks, pull-off press, suitcase carriers, and overall body. I do basic kettlebell movements. Awesome. Thoughts on the butt wink? I rounded my back in deep squat. Is that a problem? Yes, you should not be doing a butt wink. You'll get away with it. This is one of the challenges that a lot of people that work out have with recovering from back issues, is that they have the habit of doing this rounding, this butt winking at the bottom part of the spine when they do the squats. And that is going to directly put strain on those fibers, L5S1 for example. And as we do that, you might get away with it for a period of time. Maybe there's a good amount of healing, so those fibers have actually strengthened to a degree, but you're really isolating strain on that particular area of the lumbar spine. And so it creates a very difficult to predict mechanism going forwards. Was it the weight was too much? Was it that you lost the technique? You should not be doing the butt winking when we are doing squats. There are a number of markers or checkpoints that we work on when we're talking about helping you guys with back pain. And fundamentally, you want to break it down into, we talk about 3, I've been talking more recently about 3 specific targets. Number 1 is, well, it's all about load tolerance in the lumbar spine to create a framework for you to move forwards to recover from back injuries and rehabilitate the herniated disc, for example. Whether it's L4-5 or L5S1, it's the same thing, right? Number 1, you want to exceed the 40% load issue. So when we're sitting down, we put 40 to 90% more load through our lumbar spine. So you figure out what that 40% is for you in kilograms or pounds. You want to be able to exceed that. The next target is that you can exceed the 90% level. So for me, the numbers are going to be 20 kilos, 45 kilos, and then your body weight, which is, in my case, 92, 93 kilos. And so if I can do squats or hip hinges with a neutral spine without compromising form or losing my form for 10 reps without any trouble, without batting an eyelid, without thinking about it, then I need to then consider, what about my hip mobility? It might be that you're lacking hip mobility and you're trying to go deeper than you should do, and your squat actually isn't that deep and you're rounding your lower back way too soon, and that's a real problem. Equally, it might be that you've actually got really, really good form. You're squatting your body weight for 10 reps and you've got absolutely no problems. Your hip mobility is absolutely fantastic. And really, you're practically sat on your heels by the time that your back rounds. That's very, very different. And there are everything in between that. And so you've got to figure out where that is for you. Doing some effective reflection, recording yourself when you're doing exercises, and figuring out where you are at the moment. But for most people, they need to improve and spend more time improving their load tolerance before they start worrying about working on the hip mobility. That's generally the way it needs to go. Oscar has said, can I include the dead bug and side plank in my hip hinge and squat, lateral raises, bent over row? Are you talking about just including that, Oscar, in the workout itself? I'm not so sure. But if you want to include that, those are exercises that you've probably been doing already. Well, you have been doing already through the program, so that's perfectly fine. I don't see why not. Just make sure it's done in a sensible manner. I'd suggest having a look at some of the other workouts, Oscar, and definitely post in the members group. Just a little bit more detail on this, because that's a platform where we can give you a bit more support, Oscar, specifically, in terms of structuring things. Can you show 3 of done that one? Yes. Good. Yeah, Oscar, post that in the group there, but I would generally try and stick to the workouts, the main workouts, and then you can start to add things in a little bit later on. What have we got? How to treat lumbosacral spondylosis. So lumbosacral spondylosis would be another word for an injury to L5S1, right? The lumbosacral section of the spine is the green to the orange. That's the lumbosacral junction, lumbar sacrum. And so that's L5S1. That's the most commonly injured section of your lower back. And so in terms of treating that, well, you've got to do the rehab work. And then from a treatment point of view, you could do other bits and pieces, but focusing on spine stability work, that's going to be your essential. You have to focus on stabilizing that spine and learning how to stabilize the spine so you can then apply load to build load tolerance in this lower back so that it actually gets stronger. That's your route to getting better. And then you compare that with some elements of relief work, which are taking strain off the lower back on a regular basis. Manoj, definitely check out the link in the profile page. There's some more information on the program, because that'll really help guide you a little bit better. What's the difference between disc herniation and disc protrusion? They are just ends of the same spectrum. If you think about it as a spectrum, you've got over here, you've got a sequestration or an extrusion where the disc is just blown all the way out the side and there's no disc material or no nuclear material left in the middle. You've got the herniations, you've got the bulges or the protrusions. Those might be maybe interchangeable terms, or protrusion might be a little bit interchangeable with the herniation, let's say. And then you've got a more minor disc strain over here. It's just different points along the same scale. And fundamentally what you do about those from a rehabilitation point is nothing. It's not that you don't do anything, but you don't need to do anything different, whether it's a protrusion or a bulge or a herniation. You still need to do the same sorts of exercises. The levels of herniation and the symptoms associated with that with regards to any emergency symptoms are really there for the surgeon. Is he going to do something to that particular disc? Is that going to have an indication for prospects of recovery, etc.? What's your opinion on gabapentin for chronic sciatica, L5S1 spondylolisthesis, having a fusion in 2 months? The gabapentin, unfortunately, gabapentin, insert other medication for pain here, is just masking the symptoms. In some cases, it's not doing a very good job with that. One of the most important things you can do is start to build load tolerance, or rather, at least the control for your lumbar spine, and then build load tolerance. So you need to learn. You've got an L5S1 spondylolisthesis. I'm not sure of what degree, maybe grade 1, maybe grade 2, maybe grade 3, I don't know. If it's been scheduled, if the fusion surgery has been scheduled for 2 months, you have a golden opportunity here to get working on your rehab stuff to try and provide more stability. So you can maybe have a conversation with the surgeon in 6 weeks' time and say, hey, do you know what, doc? Actually, maybe we should push back this surgery because maybe I'm doing a little bit better. The reason I'm saying that specifically is because it's scheduled in 2 months' time, which to me suggests it's not an emergency surgery. It's probably that we've been really struggling to deal with the spondylolisthesis and the pain that we're experiencing. And so we've been like, well, we'll give surgery a go. And so make sure you have a look at some of the resources we talk about with regards to rehabilitation, Cody, because that might just make you think about things differently as you start to make some progress. Other questions here. 2 herniations in my disc in the thoracic area and myofascial pain syndrome and shoulders in the neck. Do you think I'll need surgery? I'll be on your program too, I think. I don't have the extra context with that, Fabio. I remember you commented yesterday. One of the most important things that you guys can think about in the context of surgery for your back pain is if you're not in the scenario where you have had, those of you that have to have surgery have already had it. You're not commenting here. If you're thinking about it, then you're not in the category of the person that must have surgery right now, because the conversations on those sorts of cases go, do you know what, Mike, I had this scenario and then I got rushed into hospital and I had to have surgery there and then because of the symptoms, right? I had emergency corticosteroid or whatever it may be. But too often, surgery is the kind of thing that's discussed. I might have surgery in 6 months, or we've had it back and forwards and this hasn't worked and that hasn't worked and maybe surgery is the only option and I'm gonna have to go down surgery route. And it's certainly not a foregone conclusion that you've actually done things correctly up until this point. Now, that's not to say some of you guys won't leverage surgery and haven't leveraged surgery to help you move forward. Maybe you've had a microdiscectomy or something like that, and there might be cases and needs. But in the scenario where you have a long distance out, 6 weeks, 8 weeks, 2 months or longer with the surgery that's been discussed, you definitely have a time frame to make some significant progress on the rehabilitation front and start to learn to actually stabilize the spine. And you might say, well, Mike, I've done my physio before and it didn't help me. I did physio. What does that even mean? I don't know what that means. Physio means you could have done a bunch of random things. More or less everyone that's ever joined the program has done quote unquote physio before they joined the program, which is a program of rehabilitation and support. And what they've done is not physio. What they've done is a little shopping list of exercises that they've done randomly, trying to figure out what they're supposed to be doing off a sheet of paper. That's not rehabilitation. That's just random stuff, quite frankly. And so you have to have an element of structure. And if you've got this discussion of surgery looming in a couple of months ahead, spend some time now, because the very worst case scenario is that you do the rehab work, you make the mistakes now before surgery, get them out the way, do the learning, get better at actually performing the movements, and then you find you have the surgery and you've already done the learning, so you can then just progress on from there, and you leverage that intervention as something that then springboards you into a full recovery. Whereas if you say, well, I'm not going to do anything until I have my surgery in 6 weeks' time or 8 weeks' time or 3 months' time, number one, you're not doing nothing. You're living life every day. You're making next to no improvement. Well, sorry, you're not making any improvement on anything. You're continuing to do the stuff that got you here in the first place. You're probably going to result in more muscle wasting and loss between now and then, and creating a steeper hill to climb in 12 weeks' time when you come out of surgery the other side. And then when you're trying to learn after having the surgery, you're going to have to make all the mistakes that are incumbent upon learning anything, because you don't know how to do it, because if you'd known how to do it, you wouldn't be here in the first place. So you're going to have to make those mistakes. And I would make the case that it's much better to make those mistakes before you go in and have something cleared up than afterwards. So that afterwards, you've already learned how to do it. So you just benefit from doing it afterwards with more control, poise, execution, etc. Oscar said, and during the dead bug, should I place my tailbone and sacrum on the floor? I engage my core, but I feel the pain later on. Oscar, I would definitely try using the towel. Your tailbone will inevitably be touching the floor when you're lying down. We've got the middle back and we've got the sacrum or buttocks is going to be touching the floor. What you want to make sure is you've got a little towel underneath the lower back if you're struggling to stabilize things. Definitely get a video up in the group of you doing the squats, of you doing the dead bugs if you're still struggling with those. It might be that you're doing a variation that's just too difficult for you, Oscar. The other thing to bear in mind is I know you do a lot of other things in the day, given the profession, and it's very reasonable that a lot of that other stuff, especially if you're noticing it later on in the day, look at all the other things we're doing outside of the workout. That's one of the big mistakes that a lot of people make, is we're really critical over the exercises, but we're really not as critical as we need to be during the activities of daily living. We're doing stuff every single day. We're having to look after clients. We're doing this, we're doing that. Many of you guys, yoga instructors, Pilates instructors, paramedic I was speaking to on the phone the other day, all these sorts of jobs that we have to do. And we spend 16 to 18 hours of our day doing that stuff, and we spend 30 minutes doing a workout, and we did the workout effectively, and then we're like, I got pain like 3-4 hours later. It's like, well, what were you doing in the 3 or 4 hours after the workout? Oh, well, actually, I finished my workout, then I sat on my laptop because I had to do emails. So maybe it was sitting on the laptop doing the emails and nothing to do with the dead bug or the exercises that we did. Those are important points of reflection, really, really important points of reflection, so we can fairly appraise what we might be experiencing. Very, very important. To think about those sorts of things. Just going back through some of the comments here. I've got steroid injections done. Any tips to help? Understanding. The most important thing to understand is when you have a steroid injection, what does it do to heal this? Nothing. And that is a very important thing to note. You carry on with rehab. Comments, just looking at these. I have a problem with sitting. My tailbone hurts. Is there anything particular for that? Ricky? So many people go through comments and posts on the internet about this issue with sitting causing pain in the tailbone. And I think there's a problem with the tailbone. It is a very, very common referral. When you are sitting on the sitting bones. If you are actually sitting on your tailbone, like, what are you doing, firstly? Because in order to sit on the tailbone, you have to sit in, like, now I'm sat on my tailbone. And if I'm sat on my look, goodness me, what am I doing to my lumbar spine? Sitting in this position. So if I'm actually sat on my tailbone, stop doing that, because it's absolutely ridiculous. You can't possibly sit like that and think that's not that's acceptable. You know, so that's the first thing. The second thing, assuming you're actually sat correctly, is if you're sat correctly, your tailbone is floating in no man's land. You're not doing anything to the tailbone. There is no strain on the tailbone. But what there is increased pressure on your lower lumbar spine. So chances are you've got a disc injury in your lower back or some kind of segmental issue at L5-S1. Rehabilitate that and make progress on the rehab. And then you will notice, as a consequence of making progress on the rehabilitation work, proper spine stability work, like what we're talking about, if you need help, check out the link in the profile page. As you make progress there, you will find that the sitting bothers the tailbone less, that you are aggravating the symptoms less, and that you are feeling better, and that you're making progress, and you can sit for longer durations before the pain starts to ensue. But make no mistake, when you are sitting down, you're putting more pressure through the lumbar spine, you're doing nothing to the tailbone, because it's not doing anything in that, it's not involved in the sitting process in that regard. So hopefully that really helps. It's a comment that we get all the time. My coccyx hurts, my tailbone hurts when I'm sitting down. It's just a real misunderstanding of what tissues are actually under strain. Ishak has said on YouTube, I have an L5-S1 herniated disc, so the same kind of problem I would suspect here. Your rehab plan works so well for me, however, I'm always develop pain when driving to work and spend around 45 minutes daily to get to the office. You know, as we make progress, so the question here, whenever we have these sorts of scenarios, what are we doing on the hip hinge? What are we doing on the squat? If we're still messing around with 3, 5, 10, 15, 20 kilos on the squat or hip hinge, Ishak specifically here, you know, well, we haven't built enough strain, right? Why can't I go and put 140 kilos on the barbell and bench press it? Because I'm not strong enough for that. Why can't you sit for 45 minutes with 40 to 90% more load through the lumbar spine? Because your spine's not strong enough for that yet. Yet being the operative word. So make progress. That's one of the important things about the rehab, because if you're doing your strengthening work on the squats, the hip hinges, etc., you have an intimate understanding. And if you've done that maths that I mentioned earlier on the live, and you figured out what 40% and 90% loading figures are, that's 40 to 90% of half of your body weight, you can very clearly go, well, the 40% figure is 20 kilos, and I'm only doing 5 on my squats and hip hinges. So I'm not actually putting more strain on my lower back, or enough to actually exact change to make me more resilient to such loading. So I have to build myself up more. Very, very simple. And as you do that, you notice that the sitting becomes more comfortable. Now, there are also little things we can do, right? When we're sitting down, as we're driving, let me just turn this around so we don't end up falling over on TikTok. When we're sitting, try your best to get the seat angle so it's away from you, but that might not be possible. If you're driving in certain sports cars, your knees are going to be up like so, very bad for the lower back. Sorry, that's all we can do. You can get wedge cushions that create a slope. This is better than this. You can see my lower back as I get into these two positions, better, less good, right? You can also get a little towel underneath the lower back so it supports your spine a little bit better. Those are little tips and tricks that you can do to help. Oscar said, what about sitting in the car? Well, there we go. just done that, so jumped on that question. Hopefully that helps, Oscar. You've got to do the best you can. Now, if you're a passenger in the car, you can always recline the seat a little bit. That's obviously going to be helpful, but don't recline the seat so much so that you're flat and then you slide out the seat belt and it's not doing anything. So important, car safety there. Kevin has said, days after recovering from sciatica, I'm losing sensation in my right toe. Is this common? You should not be losing sensation in the right toe, Kevin. So I would investigate that a little bit more. That would not be a progression, I would suggest, especially if it's associated with doing specific things. If you can do things and you're noticing a loss of sensation, you need to figure out what you're doing there. If it's more just a gross loss of sensation that's happening throughout the day or has happened, period, and it's stuck like that, then we need to get a little bit more understanding of the problem. What is the calculation again, Oscar has said? So when we're trying to come up with these milestones, we've got 100% body weight for you guys. Ladies, 75%. So figure out what you weigh in kilos. Take 75% of that if you're a lady. Take 100% of that if you're a guy. That's your target for load bearing. So you should aim for that on a squat or a hip hinge. You're not going to get there tomorrow or next week or this month. Very few of you will. But it's a long-term target. Then you've got the 40 to 90% figures. These are there to have rough estimations of your seated loading. When we sit down, we put 40 to 90% more load through our lumbar spine, specifically the lower lumbar spine. And so we figure out what half of our body weight is, and then we come up with that 40% of that figure and 90% of that figure. For me, my body weight is 90 kilos. Upper body, probably around about 50 kilos. And so I've got 40 to 90% figures on 50 kilos. So 20 kilos and 45 kilos are my figures. Those are the numbers that I want to have in my mind when I'm doing my rehab so I can compare to those. Obviously when I'm in the recovery process. Leo is a pro MMA fighter, and you've got a C7T1 issue. We've probably got some sort of issue going on there. In terms of rehab, a little bit off topic here, I'm afraid. But I would suggest, send us a DM on TikTok and say, hey Mike, could you send me a link to the Whiplash podcast? Because that would explain things a little bit more for you. Would DDD cause terrible lower back pain? I think DDD is maybe a bit of a non-specific comment. DDD is degenerative disc disease. I think the word disease is inappropriate in this case because it makes people think they've got something like, a disease, like malaria or something like that. I think it's inappropriate. I'd just call it a degenerative disc or damaged disc would be an appropriate way to think about that. And we've just got to go through the rehabilitation work. I know it's repeating, but it's the same answer, right? If you want to get stronger, rehabilitate tissues that are weak, you have to do simple things. It's not actually a secret sauce or anything like that. We just have to rebuild resilience into our lower back. Dottie has said, I've been to the hospital for my back. I can't stand, walk, or walk long, and they're going to do injections. That's Sounds like a pretty standard, standard procedure for going to the hospital, I'm afraid. The injections are going to try and ease some of the inflammation in your lower back and reduce your awareness of what's going on. You need to work on controlling the spine better, learning how to stabilize your lumbar spine. That's the kind of stuff we talk about in the rehab process. You need to learn how to protect this because evidently there's some kind of injury. It might be a major injury, it might be a minor injury. It doesn't really matter which one it is. If they've sent you home and said, oh, we're going to do some injections, they're implying that the injury should be able to heal, right? They're hoping that it's going to heal. All back injuries, your body is trying to heal every single day. Now, if they send you home with no instruction whatsoever and just give you, say, we'll do some injections in a little while, that is absolutely useless advice. You need to understand that a lot of back issues, like as I said earlier on the live, back injuries are a you problem. You need to be part of the solution. You need to be given the support and the education so that you can stop messing your back up when you go home. And so the injection does nothing for the herniation or the bulge or whatever might be there in the lower back. You need to start learning how to protect that lumbar spine, how to move in a way that stops aggravating it. Right now, you're probably like getting out of the chair, you're like, oh gosh, my back, oh gosh, bending it all over the place, getting dressed, getting off the toilet seat, all of those sorts of things has the back moving all over the shop, and it's not helpful. So instead, we need to start learning how to stabilize the spine. We need to have strategies like using contrast bathing, bed decompression, contrast bathing over this area to calm down the inflammation. I would suggest, if possible, trying to avoid the injections for the short to medium term and send us a DM. Send us a DM with a request for the surgery podcast because that's quite a good one. And whenever I'm talking about surgery in that particular episode of the podcast, just insert the word injection because the same could be said. Hopefully that makes sense, and that will make sense when you have a look at the podcast. Anyone with problems? Anyone got problems with something being wonky during a flare-up in the lower back? It is very common to have what's called an antalgic posture. Some people are stuck, like they're kind of like over to the side, and they're like this, or they're like kind of like that, and they can't straighten up because there's inflammation, a disc bulge in these little spaces where the nerves come out, and that stops them from being able to close the hole. When you change position, for example, right? So that what happens is you have a bad back, and then you're sitting down, you're trying to relax or whatever. You know, some of you guys unfortunately have the difficulty of feeling better when you sit down, which is a problem, as we discussed yesterday on the live. When you're sat down, you've got this hole here. Obviously, I'm talking about the one down here, but you can see this one better. And it's nice and large, too large, I would argue. And then that's filling with inflammation. Then when you stand up, you make the hole smaller again. Well, there's so much inflammation there, you can't actually make the hole that small because it compresses the nerve too much and irritates things. So you get stuck in this funny position. Then you try and lean one way or the other to try and prevent pressure from coming down onto that nerve and onto the other tissues there. And that's why you get stuck in that antalgic posture. And people try and do all sorts of quirky, funny things to fix the antalgic posture. But actually, if you just do the rehab work and focus on doing your best to be central, doing your best, knowing you're not going to be able to be perfectly central, you will notice as it heals and as you get control over the inflammation down there in the lower back, you start to centralize again. You start to get more straight. You go back to normal. And I've seen some quite comical videos over the years of members where they upload, like they're laughing about it after the fact, but in the moment, it's not very good. Where they upload like pictures. I always remember one of the ladies, her husband had recorded her walking through and she literally was like bent over. She's like walking like that, like through the kitchen, like literally stuck because she couldn't straighten up. And, but it gets better, it gets better. Is it bad sometimes to use freezer spray? Oscar, I think using freeze spray is kind of okay. Like biofreeze is one of the common ones. It helps, right? It's a useful tool. I think it's better to use contrast bathing because you can control timing a little bit better. But like if you're traveling on holiday, one of the things that we talk about often is take a little spray of biofreeze because you can just spray that on your back while you're sat on the plane. You don't have to carry other bits and pieces. So that can be a viable tool. But I think generally speaking, using the actual cold is going to be a little bit better. XY said, great info session here, thank you. Why do squats and hip hinges help stabilize the spine? Does it strengthen the ligaments in the back? No, when you're using, so yes and no. When you're doing a squat, you should be stabilizing your spine, right? You're learning the ability to stabilize. Like when I do a squat, I don't like wobble my knees all over the shop, right? I learn to hold them steady, right? So when I'm doing a squat, I don't like just do this. That's not a squat. That's some kind of stupid thing, right? When I'm doing a squat, I'm doing it and I'm engaging these muscles. I'm engaging the midsection to provide strength and stability and work in tandem in a coordinated fashion with the muscles of my legs. That's what I'm doing when I'm doing a squat. So I'm strengthening those tissues. Now, most of that is going to be the muscles, but steadily as I start to use load, like this is an 80-pound kettlebell, now load is going through my spine. I have load on my spine. as well as the muscles. So now as I'm doing my same squat with a neutral spine, I'm actually strengthening up the tissues over time, of course, not in the workout. In the workout, I'm challenging the tissues. But the specific tissues I'm talking about here are when you put load on it, you're strengthening up, you're stimulating the annulus fibrosus. That is the thing that you guys have injured. And so by exposing it to load with correct form, in the short term, you're just strengthening the muscles. But in the medium and long term, you're actually strengthening up the spinal segment itself, the ligaments that provide stability to that segment, and the other tissues around there as well. So that's how it works. That's how the squats or the hip hinges work to stabilize the spine. I thought that was a trick question then, at first reading. Armen LS1 has said, what role does hyperlordosis or APT play in rehab? Does it affect your ability to activate the right muscles? Should it be fixed or just pushed through rehab? Too many people think they have hyperlordosis and anterior pelvic tilt, and they don't. I would assume you don't, unless you've had it measured. So Armen, if you've had your spine measured on a standing x-ray and you have an increased, remove that, and you have an increased lumbar curve, how much is it? 20% increase, 30% increase? Was it measured on a standing x-ray? If it was not measured on a standing x-ray, then I would disregard it. I would disregard APT as well, unless it's been measured on a standing x-ray. And even if you've got a reduced or an increased lumbar curve, you're much better off starting to just focus on building stability in what you can understand as neutral, right? Because you want to have your hips over your legs, your rib cage over your hips, and your head over your rib cage. That is the best level of analysis you can have. Because let's just suppose you do know that you've got an anterior pelvic tilt and it's increased curve. Instead of having the sacrum angled at a 40-degree slope to the horizontal, maybe you've got a 50-degree slope. So you maybe got a 25% increase in the rate of slope that L5 S1 is sat on, or L5 is sat on S1. That's why we're looking at the anterior posterior pelvic tilt, because it increases the shear. If we have an anterior pelvic tilt, a true anterior pelvic tilt, the sacrum has a steeper slope to it, right? And as we talk about that, now L5 is shearing more on S1. There's more shearing forces at play if we actually have an anterior pelvic tilt. But let's just say it's 25% increased, right? How do you know that you've only done a 10% decrease? How do you know that your pelvic tuck isn't like a 50% change or correction? I.e., you've changed it by like 25 degrees. You don't know. You're not specific enough to know. And so I think people just end up messing themselves up. Like, you don't know how much tilting you're doing. You're not able to measure that. And so you're much better off focused on orientate everything correctly, engage correctly, assume you actually have a normal spine unless you have significant evidence measured to suggest to the contrary, and focus on neutral. And even in the instances where we do have a reduction in lumbar curve, I'm talking about hypolordosis, posterior pelvic tilt, which is significantly more probable, just given my experience over the years, using something like a Denerol to lie over this will increase the curve, but do that later once you've built a good degree of strength and stability, because it's quite an uncomfortable thing to do spinal remodeling if you're doing it correctly. But you need starting point measurements, and too many people think they have or have been told incorrectly based on a physical exam. You know, you've led down on the bench and they've gone, oh, look, and the same thing for leg lengths. They pulled the leg, right? And they go, oh, look, one leg's longer than the other. And then they do some stuff and then, oh, look, it's the same length now. It's like, yeah, that you're just playing around. Hopefully that makes sense, Armin. Kitty has said, I had my first epidural 2 weeks ago. Sciatica is still present. Advice to have surgery. Will physio help? Kitty, you should have been doing the rehab work beforehand. You should have been given the rehab work to do beforehand. Because sciatica is not the problem. Sciatica is a symptom of the problem. The problem is most likely some kind of herniated disc over here. If it's an epidural, I'm assuming it's probably some kind of herniated disc. And so you haven't done anything to help the herniated disc, unfortunately. And the suggestion that you're going to do any better a job healing after surgery than you have done after the injection is questionable. Like, what evidence do we have to suggest? Too often we're looking like, will rehab help me? The back pain is a you problem, right? You have to be part of the solution. You have to be doing the rehab work. And so we've all got a comment here now, BPC157, which is one of these peptides, which is associated with healing, which I don't know enough about, but it sounds really cool because it sounds like it's helping the body heal, right? And yes, Kitty's saying we've got an L5S1 herniation. So work advice, rest and see. Rest and see. I mean, it's shocking. Rest and see is not a strategy. What is rest? You mulling around your house doing all sorts of things on a daily, maybe just sat in the sofa, then you get up, move around a bit. That is not a strategy for fixing back pain. It's absolutely terrible. Unfortunately, it's not Kitty's fault at all. But no one does nothing. You're just doing a bunch of stuff around the house. It's probably aggravating the disc more. We have to do spine stability work to actually start to rebuild protection for that L5-S1. There's a reason it's not healing, and the reason is you keep flaring it up every single day. Chances are the last time it flared up and you had a little bit more pain, Kitty, because you're saying you're struggling with it, right? Chances are it's not because you're deadlifting 150 kilos in the gym. Chances are it's because you fed the cat. Chances are because you picked up the kettle. Chances are you getting dressed and you're like, oh God, that hurts. You're doing silly little things. You don't have the control over the lumbar spine, so build control. Build control so then you can protect it more. You can create a brace like my hand around the spine so it's not being pulled all over the place at any moment. And that will help start to support the body so it can go through a healing process. Kitty said, yes, absolutely. I just bend down and my back went. Yeah, exactly. I don't go to the gym. Well, you need to start, but that doesn't mean you go to the gym tomorrow. You start doing rehabilitation, learn how to control this spine. We've got many, many resources, and I would suggest go and have a look at the program. There's a link in the profile page while you're on TikTok. To learn how to stabilize and control this spine so you can then build resilience back into that lower back. And if we do end up having another injection or having another surgery, you're actually in a position to benefit from it, because too many times we think the injection is the thing I'm going to have. The surgery is the thing that fixes my back. Those treatment, or any treatment, right? It could be the decompression that we do in the room behind this wall. It could be the laser that we do in the other room. It could be some other treatment. It could be that BPC 157, the peptide. Those things are at the very top of the pyramid. They are the nice to haves. They are sometimes can help you a bit further and a bit faster. Are cool, right? Don't get me wrong, if I herniated my disc, I'm in the other room. When I bang my neck at jiu-jitsu, which happens obviously, I'm on the table in the other room. I'm with the laser. You know, those things help with healing. When I mess my knee up, laser on the knee, it helps, but I've got to do the rehab to strengthen it back up again. I have to do that work, and that starts today. Because quite frankly, you getting out of bed in the morning is more strenuous than you learning to do a squat like this, right? You getting off the toilet seat is more strenuous than you learning to do a squat like this or a hip hinge like this. That's where you might start, because you might be really bad at it, and we probably are. And so that's great, because that means there's something you can improve, and only you can do that. But that pyramid that I'm talking about, the top part being the injection, there's someone else doing something to you, needs to be on the foundation, a very large foundation of rehabilitation and education. So you start to understand these things better, so we stop tripping ourselves up every single day. Guys, coming into the last 10 minutes of the live. So if you guys have any more questions, please do post them down below. I'll keep going through them as much as I can. If you guys need any more help in YouTube, I'll post it in the chat. We've got a brand new video for the program. It's just gone through a massive overhaul, an update, and the brand new kind of explainer video is now out. You can go and check it out, link on the TikTok profile page as well, to get a better idea of what we do and how we help you guys. But if you're struggling with lower back pain, sciatica, and you need some rehab work to do, this would be the place to start. James has said, do you mean once we increase core and spine stability, it increases the No. No. I mean, well, no and yeah, yes and no. If you're constantly doing stuff every single day, James, that is aggravating and irritating the disc, then by virtue of the fact that you've improved stability and you stop aggravating the disc, it's going to be happening faster. It's not that you're getting supernatural healing taking place, but compared to you aggravating your back every single day, yes, it is going to be faster. Because what's happening is, for most people, the things you're doing every single day are aggravating and irritating and interrupting the healing process that's trying to take place in your lower back. So it's taking place at a very slow pace, probably not at all. And actually, for most people, they notice that their back pain is just getting worse and worse and worse as time goes on. So when you start doing the rehabilitation work, you stop aggravating. So relatively speaking, yes, there is a speed increase of the healing, because it's gone from not healing very well at all to actually starting to heal. But I'm not suggesting that you're going to get supernatural levels of healing. That being said, when you start to focus on things, you start to dial your nutrition in, you start to get appropriate amounts of protein intake, you're exercising and doing those other bits and pieces, then I would argue your body is in a better position to heal and regenerate compared to maybe the average. So we could make statements that maybe it is a little bit better than normal. To something to think about, right? We all know people that they just don't heal very well because they're not a healthy person. They can't recover from colds. Their immune system sucks. You know, they're just ill all the time, and they're not very healthy and well. And so that person's body will probably be running at a slower pace, a slower rate, than someone who is taking care of themselves. So we could make the statement that yes, there is going to be some increase in healing, but it's not like you're going to be getting crazy levels of healing. Now talking about that comment on BPC 157, I think the other one's TB 500 that people are talking about. Those are peptides. I don't know enough about them, but they are proposed to be improving the rate of healing beyond the normal in our bodies, and something worthy of looking at, although I don't know as much about them. My understanding is that they're mostly injectable, and they're kind of like, there are some, I've seen some oral versions of them, but I'm a bit skeptical as to how effective an oral version of those kind of things is actually going to be, and whether it's just a waste of money. So something to look into more if you're interested in that. Sarah has said L5S1, disc protrusion with impingement, L5S1, suffering since May. Sarah, have a look at some of the rehab stuff we're talking about here. Learning to stabilize your spine. Have an honest evaluation if you've been doing the right sort of stuff, or have you been given the guidance to just rest and not do too much. That's not rehab, that's not guidance, that's not appropriate, that's not going to get you better. Is it possible to have a muscle that's completely ruptured in the neck? I mean, anything's possible. I think it's unlikely, to be completely honest, but it would be associated with a very significant trauma. And if the muscle was ruptured, you probably have some significant damage to the joints underneath, because as it got ruptured, the forces at play that damage the muscle will then immediately go through the spine and would not be a good day for the spine. What do you know about kinesis exercises when you have a protrusion in sciatica? It is decompression. I don't know. I don't know, Mary, I'm afraid. It might be that it's just a different word for something. What else have we got here? Guys, those of you on YouTube, if you've got any more questions, we are getting into the last 5 minutes or so post them sooner rather than later. I know there's a bit of a lag on YouTube. Other questions, comments here. Seen you done a video on that on YouTube. Can't get rid of the numbness, tingling in my back. No back pain apart from mid-upper back discomfort from avoiding rounding and lower back. Yeah, one of the things that you guys do often notice is starting to get discomfort in this region of the back. And that's nothing to do with rounding the lower back, in this region anyway. That's because you're holding your posture a bit more effectively. You're engaging and recruiting a musculature that in so many people doesn't actually exist in their mind. This section here, right? So many people have very, very poor development in the middle back because it just doesn't exist to us. We don't really work it. When we go to the gym, we might do a lat pull down or something like that. So we can hit the lats down here, and we might do like a shoulder press, but we never really work that midsection. And so when we start doing that posture work and being a bit more upright and that kind of stuff, all of a sudden that area gets a little bit tight. Some people notice there's a degree of burning in that area, just like that muscle tension, muscle fatigue. As you get stronger, as you get more conditioned in that area, you will find those sorts of things settled more and more. Ivy, or Livy, has said, I'm a kickboxing instructor. Holding pads flares my back up every time. Yeah, that's going to be difficult. Try and navigate maybe to doing some more instruction with bags instead of the pads for a while, and work on the rehabilitation work. But something like kickboxing is difficult because we've got significant torsion and significant ballistic movements. Ballistic movements are not good. So we had a comment on one of the videos about kettlebell swings. Should you do kettlebell swings? Which is, kettlebell swing is essentially a hip hinge, except it's with movement, it's with speed, it's with explosion, and it's just a higher risk activity. Can you do a kettlebell swing and it be helpful for your back? Absolutely. It could be awesome, and it's a great fatiguing exercise, and it can really ingrain the strength and stability in your lower back and that resilience. But too many people can only do a hip hinge with 20 kilos and then they start swinging a kettlebell, which is absolute madness, absolute madness. Build up your hip hinge and your deadlift or your squat to a high level, and then start using those kind of things. Once your technique is absolutely flawless at all times, then there can be a rationale for using it. How do you become more conditioned in that area of the mid and upper back? Working that area through various rowing type exercises as a general rule, but also through your hip hinges. As your hip hinges go further over, more of the strain will load on that section of the lower back as you're holding the weights. So you will get kind of a second order benefit there. James. Any other questions, guys? And then I'm going to be wrapping it up. So I think we're just coming up to the hour. Anything else to do through here? Guys, I think I'm going to call it a day. Guys, I hope that's been helpful. I'll probably be live again later this week, maybe Friday, probably Friday. In the meantime, if any of you guys need any more help with your lower back pain, just before I go through that, is collagen supplements helpful during rehab? I take a collagen supplement, but I get enough protein on a daily basis. If you're not getting enough protein from food, from real food, get that first and then get supplements. People often ask us about what's the best supplement for back pain. Get a good diet. That's the best supplement for back pain. Get a good diet first. If you've got a good diet, then I would make the statement that, yeah, sure, go with some collagen. Like the one that we have, that we take, that's really good. Like I do notice a difference. I notice a difference most when I stop taking it, to be completely honest. But I'm always getting enough protein from my diet. So you've got to make sure you have the foundations, and then you supplement those with additional stuff. Not replace good, healthy food with pills and powders. That's not a smart move at all. So that's my word on collagen. I do think it's really good, but you've got to have a foundation of appropriate real food nutrition first. Yeah, so guys, if you need any more help, I put a link in the chat on YouTube. I put a link in you guys on TikTok, you can always check out the link in the profile page. Make sure you're following, make sure you're sharing this. If you guys do find it helpful, I really appreciate that because it helps spread the word. And any of you guys that need any more help, check out the program. We've been through some awesome upgrades over this last week that have rolled out. It's absolutely, like, we're so proud about it. And we've got some more cool stuff coming this month, pegged or pinned for launch at the back end of this month. Some more content coming out in the program. So it should be really, really cool for you guys. Thanks for joining, and yeah, I'll see you next time. Take care, guys, on TikTok. And YouTube, guys, thanks for joining. There we go. I'll see you next time. Bye, guys.